So my role here at Hertfordshire is I'm the strategic lead for all the service user and care involvement in the School of Health and Social Work.
Part of my role is to ensure that experts by experience involvement in those programmes is there from the very beginning.
So starting with recruitment and selection, where we have children from a local primary school come in and form their own interview panel. They ask their own questions and they score each candidate accordingly.
With the university has never felt like a tick boxing exercise. You know, there was real a natural relationship that was formed, which validated my lived experience of illness, but also my professional background as a social worker.
So involving service users and public involvement within our admissions interviews. So having service users contributing initially to the types of questions that we would ask, how we were framing some of those questions, helping us to think as an organisation of the things that we might want to look for. That value base that a lot of professions are now thinking about. We were trying to do that in the very early days. But we worked with people to help inform us. Every time we saw a barrier, we spoke to individuals and asked them to help us to think about it in terms of how we could overcome it together. So it's that co-production, which has been very exciting.
I believe mental health is the key to good health overall. That's why I'm here.
It goes back to my values and then my experiences. So what's important to me is that I'm a woman, that I'm a mother, that I have a disability, and I'm registered disabled, and that I am a carer and I care for somebody in the family with a mental health problem. So through all these roles, if you like, I've got a lot of sort of experience in various areas.
We wanted to bring people along with us. We didn't want to just alienate or marginalise people from a defensive point of view.
I fundamentally believe that experience is a form of knowledge, and unless we are able to gain the knowledge of experts by experience through their participation, we will be really challenged in moving the agenda on and enabling future social work practitioners to not just respect the perspective of experts by experience, but understand that perspective and understand the knowledge that that brings.
So it really enhances everything that the student is trying to pick up on. I think primarily, if you had to sum it up, it would be narrowing the theory-practice gap.
It helps us to take a step back sometimes, to think differently, to touch base with people who are the end user of service, to make sure that we remain very grounded in what it is we're doing and why we're doing it.
Once you get involved in a project and you go to a meeting and start talking to the people who are centrally involved in that research study, things become clear and they kind of accept you. Well, you think they do, perhaps, but they accept you as one of them and they like to listen to what you have to say. And I suppose progress is when they ask you what you think.
Well, obviously, we have to be sensitive not to touch particularly experiences that make people relive negative experiences. And this is a fine judgment, because you don't know enough what you touch when you get to those places. So you have to have quite clear rules, and also to have the service users aware of it, and sort of for them to take the initiative in a sense. But also when a negative experience comes to light, the question is how you handle it and what you can learn from it, and which will become a positive component.
I think, that it's important not just to be receptive to the voices of approval. But also, and equally important, is to learn lessons from the dissenters as well.
If we don't work towards service users and carers being equally involved as the academics and professionals, we're losing out on the key part of what services are all about. Yeah. So how can we do something effectively and well if we're missing out on that perspective, if it's not there equally in our discussions around the table?
Yeah.